slide is still there.
And you're live, Steve.
Okay, so the slide coming down.
You're live now, Steve.
Okay, I got the slide on my screen, that's all. Bore da, croeso, all. My name's Steve Davis and I'm Director of Education for Welsh Government. Welcome to this session titled Science and Public Health Evidence for Primary School Head Teachers. We're here really, as the title says, to discuss the next steps we're taking to enable some of our young people to return to school, and critically, science and public health conditions that allow us to do so. We've been in intensive discussions with local authorities, teacher unions who've had the opportunity to speak to our scientists and expert advisors. Your union representatives have been very clear. I'm particularly concerned that we create the time to look to communicate with you directly, to share the science and medical research and understanding that underpins our decisions relating to returning to a more face-to-face teaching and learning. We want to give you the opportunity to hear from our colleagues who lead on these areas within Wales. We have helped, and they've helped us decide why we think the conditions are right to start a cautious, phased return to face-to-face teaching, but also to give you the opportunity to put questions to them. And I'm impressed with the questions that are already coming in, so please keep them coming in. I'm joined by Dr. Chris Jones, who's our Deputy Chief Scientific Officer. For those who watch the lunchtime briefing, you'll see Chris there alongside the Minister helping with the announcement. Dr. Rob Orford, our Chief Scientific Advisor, Dr. Heather Payne, a paediatrician and our Senior Medical Officer for Child Health, and also some of my colleagues within Welsh Government in Education and Childcare, and that's Nick Edwards, Deputy Director, Childcare, Play and Early Years, and one of my key team members in dealing with the pandemic, Kelly Murphy, who is head of our COVID-19 response for schools. This is the first time we've run such a large virtual event. We've already gone through the 1,000 mark and we're heading through 1,100 participants. So I sympathise with you all who've had to run remote teaching for the first time in the last 12 months, not without challenges. Before starting, some housekeeping. The session will run for 45 minutes. Because it's open to all primary schools, there are over 1,000. It's not possible to allow you to put questions directly using this system. We'll try and answer the most common questions as they come through, but we'll also provide replies where we can to common questions after the event. Say the sheer volume means that we can't respond to them during the event. If you do experience technical issues, we are recording the session and it will be sent to you via disk later today, so it will be available. Now you'll be aware that the Minister is making a number of announcements today at lunchtime today. So Kirsty Williams will be taking the Welsh Government press conference. This information has not been released to the media yet, but she will confirm after half term from the 22nd of February, our foundation learners will start to return to school during that week. This is in addition to the children of critical workers, vulnerable learners, special schools and PRUs. We've prioritised our youngest learners because of the evidence on transmission in younger children, and also because we know they find it most difficult to learn remotely. And we'll be going into that science, as I said, in a moment. Small numbers of vocational learners, including apprentices, will also be able to return to college. Again, this is because of the difficulties with remote learning in a practical subject. They'll need to access training on workplace environments in order to undertake their practical qualifications. We've been engaged in discussions with our union colleagues and local authorities, and we have developed and will continue to look at developing mitigation opportunities. in introducing a number of measures to provide staff with an added level of assurance for their safe return. This does include the opportunity for twice weekly testing for staff members, as well as an increased financial support for new effective face coverings. We are also providing an additional £5 million to support schools and colleges and local authorities to invest in items they need to keep their premises safe. We would not take these steps if we thought it was putting you and your staff at risk. And this is why I've asked Chris, Heather and Rob to talk to you today. All of them are members of the Welsh Government Technical Advisory Group, known as TAG. And they work with SAGE and advise Welsh ministers on COVID. TAG has published a paper today that's advised Welsh Government that there is enough headroom to start to open up education to face learnings, and colleagues have come from that TAG meeting and those discussions this morning. At this point, I'm going to hand you, or in a moment, I'm going to hand you over to Chris Jones, but what the process will be, Chris will do a short presentation. Rob will talk briefly about the impact on schools, and Heather will talk about impact on children, and then we'll throw it open to questions for the rest of the session, because for us it's important to give you that opportunity. I'll hand on to Chris.
Thank you very much, Steve, and good morning, everybody. Thank you for joining us. We have 4 slides here this morning that summarise the public health position. These are the same slides that we're planning to use at lunchtime for the press conference. So this is the first slide of the weekly 7-day incidents since October the 1st last year, showing essentially the story of the second wave of the pandemic. So you can see that cases rose towards the end of October, and then the 2-week fire break or 17-day fire break was put in place, and you can see there was a beneficial effect from that. But then cases rose very rapidly again before Christmas, and then the current level 4 restrictions were put in place on the 21st of December, shown on the plot. You can see that at its worst, our average case rates across Wales were over 600 per 100,000, which really was a very high and concerning level. So you can see, though, gratifyingly, since the restrictions that are in place now have been in place, the case rate has progressively come down. There's been some disturbance after Christmas and New Year, probably due to different behaviours then and some uncertainties about data. But the most recent data show a sustained fall, and the current position is that the weekly case rate is around 120 per 100,000. The case rates are falling in all areas of Wales, which is very pleasing. The areas perhaps in the north that were the highest at the peak of the situation before Christmas are falling most quickly and catching up with those in the south. But there are clearly still some differences, but all are going in the right direction. I would say that this response to the restrictions is very gratifying, because we know that the new virus variant that originated in Kent is now the dominant variant in Wales, and it is pleasing to see that actually the restrictions in place are overcoming its impact. So we are in a much more favourable position than we were 6 or 7 weeks ago. The next slide, please. As you know, we are very concerned to protect the NHS, which is important for preventing so many of the harms caused by COVID. This is a current position of the NHS bed occupancy with patients with COVID, and you can still see from the top grey line the total number of confirmed, suspected and recovering patients in our hospitals is considerable, at around just under 2,500. But this really is still a significant challenge for the NHS, particularly when you think this was a disease that did not exist a year ago. But if you look at the confirmed COVID cases on the orange plot, we can see that actually as the case rates have fallen, we've seen a stabilisation of that number in hospitals, and now we're starting to see the number decline, which is encouraging. This is a very kind of delayed indicator because it takes some time for new cases to become so unwell as to need hospital, and it does reflect the pattern for those with the most severe cases, but it is pleasing that actually there are some signs now that hospital pressures are beginning to ease. So next slide, please. So this slide shows the story of the R rate since June, in fact, of last year. And you can see that the R rate rose above 1 as all the cases increased before Christmas. As you know, an R rate above 1 means that the pandemic is accelerating in an exponential fashion, and an R rate below 1 shows that things are falling in an exponential way. And it is pleasing that we currently see an R rate significantly below 1. There are bars that indicate the R because these are estimates, but Public Health Wales currently estimate our R rate to be just over 0.7. So this is pleasing. It's consistent with the numbers falling clearly, and it does suggest to us that there is now some room for some very cautious easing of restrictions, as Steve describes. And the final slide shows one of the reasons why we can start perhaps to become optimistic about the future. And this is the rollout of the vaccination programme in the 4 countries. Wales is the green line, and you can see that actually there's been the most impressive acceleration of the rollout of first dose vaccinations in all of the countries of the UK. Over 10 million people now vaccinated across the UK and over 470,000 in Wales. But you can see also that the pace of vaccination has picked up considerably, and Wales recently has been leading the UK countries. So the reasons to be optimistic about the next few weeks and months are that the case rates are falling. Most restrictions on the public will undoubtedly have to stay in place for longer, and so this will continue to exert a downward pressure on the R value, but there is some room for manoeuvre. There's also the seasonality of the coronavirus as well, which is now starting to act in our favour. As the weather improves, we would expect case rates to start to fall, and obviously also the rollout of the vaccination programme gives us cause for optimism as well. So this is why we are advising ministers that there is at present a small window of opportunity to ease restrictions in relation to young children returning to school.
Thanks, Chris. That's really helpful. I'm now going to ask Rob Orford, who I introduced earlier as the Chief Scientific Advisor for Health, and Rob's going to focus on the impact on schools.
Yeah, thanks very much, Chris. I don't know if people can see me or see the slides. I don't have a set of slides, so I'll just try and speak freely. This is remarkably complicated, and we're very busy constantly reviewing the evidence and reiterating our advice, informing policy colleagues about what works well, what evidence that we have, and helping plot the way forward. Some of the questions that we've been asked and we've tried to answer is, have we got enough headroom for this easement? And I think it's really important to say that the government take the education of our children very important, very, very seriously, as well as the NHS and how we can prevent further harm. So the direct harms from COVID, but also the indirect harms from offset operations and such like. So it's not our goal to see exponential growth. Our goal is to get it low and to keep it low and to vaccinate as fast as we can, but also recognizing that we're accruing educational harm that will hurt us down the line and hurt the most vulnerable children in our society. And so we're constantly having this debate and dialogue about balancing harm, and it's really difficult. And I appreciate that it's really difficult for you as head teachers in safely opening up schools and trying to negotiate and navigate this with your staff, and also with the parents and children that you teach. So questions that we've been asking ourselves: have we got the headroom? Should we be doing this now? And as Chris said, things are looking good, they're heading in the right direction, and we will constantly monitor this as time goes, to say, yeah, this is good, and we will constantly monitor this as things go forward, gently and gingerly go forward, such that if they change, we will say so immediately. Now, things have been slightly confounded by the arrival of this new variant, and they will come and they will change, and we will monitor them, we'll adapt, and we'll overcome them. And there'll be lots of hyperbole in the press about them, and we just have to manage those expectations. But this is what's going to happen with the new coronavirus that's with us, right? It's not going anywhere. We'll vaccinate. That may impact on, well, that will impact on disease burden. It may impact on disease transmission, and we will know more about it as we move forward. But that's a really positive news story. But we will have to adapt to it, and this is going to be with us for a few years, I suspect. So we need to be able to open up and redact back and go to that sort of substitution event of blended learning, I suspect. Again, let's hope not, but we have to anticipate that. So our advice is, look, we do seem to have some headroom now. We don't want to see exponential growth. So our advice is, don't open up everything at the same time, titrate things in slowly. We think it's safest, certainly from the data, for the younger age school children. It will enable more adults to mix outside. That will facilitate more community mixing, which we're aware of. And our advice to those parents is, this doesn't mean we're back to normal. Please don't mix. Please don't have different children around your house. Please don't be mixing at the school gate. So all of us have a duty and a responsibility to say, we are not back to normal. We are prioritising the education of our young people. So that's our advice. We've looked carefully at data around transmission between adults, and I mean, that is a really good way to have transmission from household to adult in a school. So we need to think about that, how we mitigate that very carefully. We can see transmission in friends in school, and so bubbles, consistent bubbles with no adults going between bubbles, symptomatic children not coming to school, that works really well. And I talk about the Swiss cheese defense, where we do lots of things well, the hand washing, the social distancing, the things that we're doing already work well. And we just need to keep asking ourselves, are we doing everything that we need to do, and we're not dropping our guard? I know this is very, very difficult for everyone. It's not our ambition to do something that we think is unsafe, and so that's why we're advising to go back cautiously and review at the next time point, and then layer on more as we go, and just watch this unfold. So I hope that's helpful. I'm very happy to take any questions, but I think Heather probably wants to come in.
Yeah, thanks. Well, so we'll now move on to Heather Payne. And Heather will talk about the impact on children, and then we're going to go into to answer some of the questions that have come through the chat. So the question and answer, Heather.
Thanks very much, Steve. And I think Chris and Rob have they've given you all the information that you need. I suppose I'm coming at this as a paediatrician, and like all of you working directly with children, you know, just understanding that how do we apply all that science and all that data to the real life effect of having children in school, especially the youngest children, and doing the things that little kids do. And I think the first message that I'd like to reflect is that we all share the same anxieties. We're all worried about the possibility that these rates would go up again because of schools being open. And we're all worried about the question whether or not teachers are safe to be in school. The reason that we've come, that the advice has got us to this place, is because all the information that you've heard is telling us that the rates are going down, that children are going to be better off. Now, you don't need me to tell you the benefits of children being in school. It's not just the learning, although that's tremendously important, but it is the socialization, it is the learning the good habits, and socializing with other children, emotional well-being, communication skills generally, problem solving. So we all agree that being in school is tremendously important. So the question then is, how would that work? And of course, we know we keep saying the same things about social distancing, and then we say, well, we know that children aren't that good at social distancing, but that's why the bubbles are incredibly important, so that although some children are incredibly good at internalising these issues. I went for a walk the other day, and a little boy on a bike, he stopped riding and put his head down. He must have been about 6, and his mum, walking behind as we were socially distanced, he says, "I won't breathe until you've gone past." So, you know, children can teach us a huge amount. So using children's own ability to internalise these messages is tremendously important, and I know you're doing that. And the evidence tells us that bubbles are working, that the numbers of outbreaks in junior schools is actually very low. We've been monitoring that, and it remains low. So that's important. Again, the balance of risks and benefits are incredibly clear, that children don't get much illness. They don't transmit this virus as much as others, but they do benefit from being in school. So that's fantastically important. This cautious return will be accompanied by the same daily monitoring that we have been doing all along, so that if we see a signal of infection spreading, then we'll do something about it and respond to that straight away. And of course, there's a plan for using all the things at our disposal, including the possibility of testing. So we are setting a structure where we know what's happening and we can respond to any problems. But we rely on you doing what you always do so well. And we know, as I say, from the data that we get, that actually the bubbles and the controls are working.
Thanks very much, Heather. I'm now going to move to the questions. And the first question is concerns with Wrexham infection rates and whether teachers in one local authority in Wrexham should actually return. And I guess this gets into the geographical. We do everything across Wales or in different ways on a regional basis. Chris, do you want to start on this one?
Yes, thank you very much, Stephen. I mean, it is clearly a very understandable question. There has been significant difference across Wales from local authority to local authority, and those differences have varied considerably with time. And actually, the position of certain local authorities can be very poor at one stage, and then 2 or 3 or 4 weeks later, they can be very favourable. So I think it is something that we will need to keep a close eye on. But at the moment, the evidence seems to be that those local authorities where rates have been high are converging towards the same place as the local authorities that have had lower rates. Their rates are falling very rapidly, amongst the most rapid in Wales for Wrexham. And if we can, we want to provide all children in Wales the same opportunity. There has to be an issue about equal opportunity for everyone. My concern is that young children run the risk of being innocent bystanders in this, because they are not threatened by the pandemic, but they are threatened by the measures that we take to protect the rest of us. And we do need, if possible, to put their interests first and get them back. But it is clearly something we need to keep an eye on.
Okay, thanks, Chris. I'm going to go to the next question. I'll take this one myself, actually, because I can do it quickly. Relatively, it's the question about will testing be available for all? Yes, we're looking for all staff to have access to testing twice a week. It may take a small amount of time in that first week to actually get it fully up and running, but this is going to be provided or available for all staff. The next question is about vaccination for those who are providing intimate care, and why aren't the vaccination more generally to all teachers? But basically, why not all teachers? Who wants to take that, Chris? Thank you.
Yeah, all of the 4 UK countries are following the advice of the Joint Committee for Vaccination and Immunisation. And this is a long established, very highly respected independent committee, which has always advised on the vaccination and immunisation strategy. And the cohorts of people in the population who JCVI say should be vaccinated now are very carefully worked out on the basis of the evidence, with the purpose of reducing the deaths due to COVID. So the categories of people that account for the death rate are those people that will be vaccinated first. So this is generally the elder people, because they account for the vast majority of deaths in hospitals and in the community. It is people who are clinically extremely vulnerable. And teachers at the moment, well, there are no occupational groups other than health and care workers, but they have demonstrated, unfortunately, very high rates of COVID themselves and deaths from COVID. But teachers actually, although one values massively the work that teachers do, the teachers at the moment do not contribute significantly to the overall death rate, thankfully. In fact, teachers' outcomes are very similar to those of the general population. So at the moment, there isn't really a justification. This will all, in a sense, have to be continued to be discussed, because once we're through this initial set of cohorts that represent the people who are at risk of death, then there'll be a wider rollout across the population, and then there'll be different discussions. Teachers who provide regular personal care to children with complex medical needs will be considered social care workers and will be vaccinated.
Okay, concerns about children actually being the spreaders of the virus. Do you want to take that, Heather? Thank you.
Yeah, thank you. Again, everybody can spread the virus. It's just that the evidence that we have is that children don't spread the virus more than others, because if they did, and I'm talking about these youngest children now, we're talking about foundation phase children, they consistently have the lowest rates of infection. And whilst we know that spread does happen from and to children, this is most likely to happen in households. And the latest evidence that we've just had from the work at Swansea University does actually bear out the fact that, yes, children are capable of spreading it and do spread it in school, but these are low rates. And again, we measure that by the daily infection rates and whether they are associated with schools. And what we have seen consistently is that there are single cases in schools or no cases most weeks. Those are the biggest categories. And there are very few large outbreaks, which would be the sign of children spreading in school. Again, the message is that the isolation policies, the following all the instructions to stay at home if you have symptoms and get a test, those are working. So therefore, yes, everybody can spread it, but the mechanisms that we've got in place in schools are effective. And again, a number of the points that have come up in the questions, it's a corollary to that, that if spreading happens in households and places where people have lots of contacts, making sure that teachers, that parents at the school gate don't mix. Again, it's a message that we're trying to make very clear, and it will be important for schools to reinforce that message. And things like, just because your kids are in a bubble together in school, don't have sleepovers. People think that it must be okay because they're in a bubble, but it's not.
Okay, there's a question that's come through on giving 2 weeks notice. I'll take that. When the First Minister made that announcement, it was 3 weeks ago, sorry, a week ago. So we were looking to give the indication that it may well be required, expected that we go back on the 22nd. We do not expect staff to be working in schools. When we were looking at schools going back as a whole, a full school, as we did in the back in September, we gave that 2 week window of actual staged and phased return. I think if you read carefully what we're looking to do from the 22nd, and we do expect all foundation phase children to be going back in the week of the 22nd, and certainly all of those children back in by the end of that week. But we've tried to create some flexibility there to enable that to happen. But we do feel that for this age range and the number of children involved in the great majority of schools, that this will be managed and be able to delivered in the time between now and the 22nd. But I reiterate, we do not expect staff to be in schools over half term. We expect them to be taking a break. Next question is, are staff expected to wear face coverings within the classroom? Who would like to lead on that one? Heather, I know we're updating our guidance here, but I think if you can take that, Heather, that'll be helpful. Thank you.
Yeah, certainly. There's been a recent publication from Public Health England, which has been a rapid review of the evidence on face coverings. And it's extremely difficult because it's really difficult to do any kind of experiments. So they've been observational and ecological studies, and so they haven't had the normal experimental controls. But they do contain very large numbers. Long story short, the conclusion is that there is more evidence that public wearing of face coverings, good quality, preferably 3-layer, certainly multi-layer face coverings, not just a single layer, does appear to be associated with a control of COVID spread. So we have already advised encouraging wearing face coverings in more contexts in school. However, just like the original guidance that was put out, I think last August or September, this is a balance with children, as you well know. Because children, and especially the youngest children, get an awful lot of their communication from facial expression. Children who, may have hearing problems, even temporary or permanent, need to lip read, and they need the visual cues. So these have to be a balance in the classroom. And I think it's unlikely that the balance would be in favour of wearing face coverings in the classroom with children of this age. However, it's absolutely vital that in the communal areas, and especially when teachers and other adults are together, they consider wearing face coverings in any communal areas. So again, the information that we have is that the spread amongst teachers in schools is from teacher to teacher, from adult to adult, not from children to adult, especially at this age. So again, it's using the data in order to do the things that will help everybody. But that's certainly the new advice, which does strengthen it, and also advising people to wear it when they pick their children up from school. That would also help outside the school gate.
Thanks, Heather. I think this one is for Chris. What effect will opening schools have on wider community transmission?
Well, I may deflect it back to Rob, I think, actually.
Sorry, to be honest with you, I meant Rob, Chris. Sorry, I did mean Rob.
Rob's been very quiet.
Nice. That's an easy mistake to make. So, well, look, schools are part of the community, and we very carefully need to look at community transmission. Public Health Wales have also developed a school surveillance system, so we'll also be looking at outbreaks and infections in school. And if we see any changes, then we'll act on it and advise on it very quickly, and we'll constantly monitor the data of what's happening in schools and outside schools. As I said previously, it's not our intention to see exponential growth, so we very carefully need to consider this. Steve, I've seen a few questions in the sidebar around bubbles, and I fully recognise this is really difficult. Operationally, running a school is very, very difficult. But I think bubbles need to be exclusive. The purpose of the bubble is to contain an outbreak within them. And so if you have people going between bubbles, then it's not a bubble. Then you've got an extended bubble. So stopping transmission between groups and keeping outbreaks small is the purpose. Now, that may not be practical for you. And so all of these things, the bubble should be as low as practically possible. Now, if you've got teachers going between bubbles, then you just need to recognise that is an opportunity for transmission to happen between those groups. So I simply cannot say you need 30 people in a bubble. That's not possible. But you just need to look at what you can practically achieve. What's the lowest that you can do? What's the best that you can do? And it will be different in every school.
Okay. This question.
Can I come in as well, just to add?
Yeah, certainly.
To understand the impact of schools on the R rate has always been a difficult challenge, because generally when schools have opened, other changes in society have happened at the same time. So it's been very difficult. However, we have an opportunity now with this very limited single change to evaluate the impact. And it will be important that we do that in Wales. So this is a very, very limited measure, just these very low risk children going back to school. And it will take 2 or 3 weeks before we can see the impact of that. But I think it's true to say that the estimates for the impact of opening schools on the R rate are perhaps it increases the R by 10 to 50%. But I think with this very limited change, we might expect it to be around the 10% impact. But it will be interesting to see, and we will have an opportunity, which we haven't really had before, to see what the impact will be in truth.
Okay, the next question I'll take myself is how foundation phase teachers manage online learning with those pupils still at home and face-to-face learning. And this is also questions here around how do you manage this when years 3, 4, 5 and 6 are back in. The position is we would expect with all foundation phase children coming in, that staff not being required to do the remote learning because the children are in the school. There will be some children from vulnerable children or children of critical workers in the older phase of primary school. Again, we'd expect a proportion of staff to be working with those young people and a proportion working at home and providing the remote learning. But managing that across those 3 phases, we believe is manageable. But clearly it will be up to the head teacher and the staff to decide how that works proportionately. There's back to you, Chris. Why are we not waiting a few more weeks until it's safer and staff feel safer?
Well, I think we do have some headroom to do this now. And again, we have to consider our duties to these children who need to be in school. We have headroom now. The case rates are falling. They're at lower rates now than they were when schools were open before. We know that schools opening to this limited extent will be safe because we know that teachers were safe before, even when case rates were much higher. So we know it's a safe thing to do and the right thing to do for children. I do understand that teachers, are fearful, and I think we have got used to the idea that maybe children spread infection, and that's been the case for other infections, flu in particular. But this is quite different. These young children are very unlikely to spread significant infection, and teachers' outcomes are actually very similar to those of the general population. So teachers can be reassured that this is a safe thing to do now, but we will keep a very close eye on it.
Thanks, Chris. I'm now going to ask Nick Edwards to respond to one of the questions that we've had, and it is about is it safe for children to attend 2 provisions, for example, mainstream and wraparound? And what's the type of advice when we know parents are not following the rules? Nick, you there?
I am, but I don't think I'm on the screen. Yeah, hi.
You are.
So this is an interesting question that comes up quite a lot. So for as Steve explained, my lead area within Welsh Government is childcare play in early years, and you've just heard Rob very eloquently explain the need to keep bubbles as small as possible and to ensure that we do not have people moving across bubbles if we can possibly avoid that, and that is really, really important. But I'm also acutely aware, and we're all very conscious, that for some families the only way that they can make some of this work, particularly if they're working in jobs that don't fit in neatly around the school day, or they're critical workers who are perhaps working shifts, is where they make use of what we call wraparound childcare, either at the start and end of the school day. In some cases, they might use family members to do that, or friends on an informal childcare basis, or they might have done before all of this. And sometimes they use registered childcare providers that operate after school clubs or breakfast clubs or childminders or other childcare arrangements. Obviously, we're really keen to keep children in one bubble wherever possible and to reduce the amount of contact they have with other children. But we are going to be as pragmatic about this as we can be and accept that if children do have to be in two settings, it's better that they are in regulated settings like childcare provision, where we can control the bubble and if necessarily trace any contacts that they've had, rather than potentially moving between different homes of family and friends on different days, which is what might happen if we don't allow parents to have that flexibility where they can use two regulated settings. It's not perfect. We'd like to try and be in a position where people were only using one setting and one bubble, but you know your families, you know your children, you know that that's not always going to happen, and we need to build some of that into our thinking here. What we're going to do is make sure that we provide some really clear messaging to parents around the importance of minimising the numbers of contacts that they and their children have. So you've heard my colleagues Rob, Chris and Heather talk about that, and the importance of getting across to parents that a return to school for these children does not mean a return to normal life. It doesn't mean sleepovers, it doesn't mean parties, it doesn't mean meeting up with your friends in the park. It means keeping those contacts as small as possible and for the amount of time that they need to be in school or childcare, but it doesn't mean a free and easy lifestyle and doing what you want on your weekends. And that's the messaging we're going to try and get across to parents as much as possible. It's not necessarily something that some families are going to welcome. Do I think every single family in your schools is going to abide by it perfectly? Probably not. And you'll all come across families that are breaking the rules, and we'll have to work together to manage that. We've been working very closely with the childcare sector. They're very willing and happy to work in partnership with you to make sure that we get the arrangements in place to support your schools and to try and manage the bubbles and the contact groups and make sure that we have these open and honest conversations about where cases are happening so that we can track things through and keep staff across both childcare and education as safe as possible in the current circumstances. So we'll be reflecting that in our guidance both for schools and for childcare settings.
Okay, I've got 1 minute left, so I'm going to take the last question. When will Key Stage 2 return? Rob, Chris and Heather stressed we're taking a cautious approach, and the colleagues are saying we need to look over the 2 to 3 week period what is happening. The next review, the FM is engaged in on the 19th of February, where they're looking at, that's a 21-day review. But I'll go back to the principle. We need to see the impact of this. This will be the first time in this pandemic where we've taken, or the government has taken the decision that the only area for headroom is education. So we want to monitor the impact of that. I will be working with groups of head teachers who I've invited to work with us on what would an effective potentially involving rotas, what would an effective safe management of that, but also looking to the data and what the messages are giving us in terms of the wider infections. But I stress we will be using caution, we'll be modelling, looking at the opportunities and impacts, and you will be well aware of what will be emerging as potential proposals, but they will always be looked at through the lens of safety and caution. So I'm going to conclude here and thank all of colleagues for their contribution. I hope you found it useful. Just to say that this session will be recorded on Hub and available for you and other colleagues to use. So if you want to engage part of the programme with your staff, be delighted that you would use it, and we'll continue to have these opportunities. It's very frustrating for me, and I'm probably more frustrating to you, that we can't interface and work and interact with these discussions. But it's a best attempt for us to try to communicate those messages. Thanks very much. Diolch. Go carefully.